Trauma can make you feel like a stranger in your own body, but there are DBT skills that can help you find your way back home. Hi, I'm Dr. Kiki Fehling, psychologist, author, and expert in dialectical behavior therapy, or DBT. If you're dealing with the impacts of trauma, this video is here to help. I'll be teaching you 5 DBT skills that can support you in coping with trauma symptoms. I also want to address one of the biggest misunderstandings I hear about DBT and trauma. But for now, let's jump into the skills that may actually help you. Number 1 is distraction with physical sensations. When you're dissociating or your mind is spinning from trauma flashbacks, this coping skill pulls you back into the present moment. DBT offers tons of distress tolerance skills that can help in stressful moments. Distracting through physical sensations is one of them. A popular method is the 5-4-3-2-1 technique. Right now, name 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. But you can also practice grounding by invoking intense physical sensations on purpose. So try stomping your feet on the ground, biting a lemon wedge, listening to loud music, or running your hands under cold water. Basically, do anything that pulls your attention away from what's upsetting you and into your body, as long as it doesn't harm you or make you feel worse. When you feel numb, paralyzed, or overwhelmed by trauma triggers, grounding in physical sensations anchors you back into the present moment so that you can get out of flashback spirals and remember that you're safe right now. Number 2, the TIPP skills. Trauma survivors know that telling yourself to just calm down doesn't work, but these 4 science-backed skills actually do. DBT has a set of skills called the TIPP skills that can help people cope with panic, stress, and impulsive urges. TIPP is an acronym that stands for temperature, intense exercise, paced breathing, and paired muscle relaxation. All 4 of these skills are designed to help you regulate your nervous system when you're overwhelmed. Let me tell you about the first one, temperature. This skill simply asks you to fill a bowl or sink with ice water and dunk your face in. Kind of intense, I know, but it activates a body instinct called the mammalian dive reflex. When you put your face in cold water, your heart rate slows down, which is perfect when a trauma response has your heart pounding. This skill actually works so well that if you have heart problems, you should talk to your doctor before using it. All 4 TIPP skills can be incredibly helpful when trauma symptoms have your nervous system revved up. They give you concrete ways to use the mind-body connection and help you get through stressful moments. If you want to learn the other 3 TIPP skills, check out the video linked in the description box. Number 3, self-validation. If you chronically doubt or gaslight yourself because of trauma, you're not alone. This DBT skill helps you trust yourself again. Invalidation is the communication that your emotions or reactions are wrong, weird, or bad in some way. Traumatic invalidation is being told you are wrong or bad in some way. It can lead to lots of different mental health struggles. The skill of self-validation is communicating to yourself that your inner experiences make perfect sense. Because if you're feeling something, there's always a reason. There are a few ways to start practicing. First, give yourself space and time to actually feel your emotions. When you pay attention to something, you communicate to yourself that it matters enough to pay attention to. So to get more in touch with your emotions and with yourself, practice mindfulness of your emotions. Let yourself feel your feelings. Then put words to your experiences by journaling or talking to yourself. Describe for yourself why it makes perfect sense that you feel the way that you feel, why you reacted the way you reacted, or why you are the way that you are. You could say to yourself, of course I feel scared after what happened to me, or it makes sense I have trouble trusting people given what I've been through. Self-validation doesn't mean you have to like how you're feeling. It doesn't mean you don't want to work to change how you act. It just means that you understand why you're feeling and acting the way you are right now. Trauma survivors often struggle with feeling like their emotions and reactions make them crazy or too much. Self-validation can help you better understand your experiences, regulate your emotions, and stand up for yourself. Number 4, mindful observing. Trauma can disconnect you from your body and make it hard to know what you're feeling. Purposely practicing mindfulness can help. In DBT, we defined mindfulness as simply being present, bringing your attention to this moment, right now, whatever's happening. It's a foundational mental health skill, particularly for trauma survivors who struggle with dissociation or disconnection. One way to practice is to simply bring your attention to your body. You might scan your entire body, noticing physical sensations like the pressure on the back of your legs, or the feeling of your shirt against your neck. tension in your shoulders or pulsing in your fingertips. And if bringing attention to your full body feels triggering, just focus on specific parts. Maybe you focus just on the physical sensations in your feet, in your hands, or in your head and face. Take breaks, take deep breaths, do it as much as you need. The goal of mindful observing isn't to change anything or to evaluate anything. It's just to notice with curiosity and compassion. The more you practice, the easier it gets. For trauma survivors, reconnecting with your senses in this gentle way can help you learn to trust yourself and feel more grounded in your body. Number 5, self-soothing. When you're feeling raw or overwhelmed, this coping skill acts like emotional first aid. The DBT skill of self-soothing is all about using your senses to nurture and physically comfort yourself when you're struggling. You can use any of the senses to self-soothe: sight, hearing, taste, smell, touch, as well as temperature, pressure, or movement. You might try wrapping yourself in a fluffy blanket or a weighted blanket. Maybe you go on a walk, listen to ASMR, watch a burning scented candle, or eat your favorite comfort food. You may find certain physical sensations triggering, so trust your instincts. Experiment to find what genuinely feels comforting to you. Skip the self-care that feels corny. Self-soothing isn't about fixing something or making distress disappear. It's about offering yourself physical self-compassion during painful moments. When your nervous system is activated, self-soothing can bring you back to a sense of safety that can make difficult moments just a little bit easier to get through. Okay, now you've learned 5 DBT skills that can help trauma survivors. Before we end, let me clear up a huge misperception that DBT is not an appropriate treatment for people with PTSD. That DBT is just a Band-Aid and doesn't help with true healing from trauma. So yes, many DBT skills are meant to act as Band-Aids or short-term solutions for emotional pain. But DBT skills are meant to help people cope with overwhelming emotions so that they can engage in deeper trauma work safely and confidently when they need to. There are even several types of DBT that research shows can successfully treat PTSD. And that's because real DBT is a comprehensive, trauma-informed therapy with group sessions, individual sessions, phone coaching, and more. It's way more than just DBT skills. Even this video is just an introduction. There are dozens of DBT skills for emotion regulation, distress tolerance, mindfulness, and interpersonal effectiveness. These skills have been shown to be helpful for PTSD, and learning them can help you get the most out of trauma treatment, especially if you choose an evidence-based therapy like DBT prolonged exposure, cognitive processing therapy, or EMDR. If you're dealing with trauma, you deserve support. Healing is possible, and you don't have to do it alone. For help finding a therapist, check out Recovery.com or the other links in the description box below. If you want to learn more DBT skills, I teach many of them in my other videos and in my books. Keep in mind, DBT skills can be tricky to learn, especially when you're dealing with PTSD. Be patient and compassionate with yourself as you practice, and thank you for watching.